Hey guys, welcome back to the channel. It's Adley Abrams here. I'm a doctor working in George Hospital. I'm doing my pediatric training. First of all, I'm doing this video in the on-call room and it's a little bit messy, so I don't even want to show you what's happening on this side. This is the clean section. Doctors can be messy. What are you going to do? It's not me. I promise it's not me, Mom. It's not me. So I thought I'd talk about something a little bit funny this time. This is something that every doctor that I know of, including myself, goes through. So the minute you become a doctor, even while you're a medical student, but specifically when you become a doctor, you get family members that come up to you for all these consults, right? All of them. Now, it happens to everyone, and I'm thinking about it because we were talking about it today with my interns. They are new doctors and they are telling me, they actually come to me and they say, look here, what do you think this rash is? Or what do you think what should I do about this sugar level or this blood pressure? Or should they go to this doctor? Because they get all these referrals or questions from their family. And it's a common thing, all my interns get it. I just got a message. I just got a message. It's something that happens with all the doctors, and they all complain about it like it's this big drama in their life. I don't see it that way, and many doctors do. Actually, I've never heard of someone who says, no, I like it when family ask me questions. Many doctors, actually all of them, have complained about it, and they say, oh, why did they ask me these questions? And I'm like, why not? And I always have to remind them, like, you are a doctor. Clinics suck. Nobody wants to sit in line in a queue. If you've got a doctor, why wouldn't you ask them, is this something to be worried about? Should I discuss it further? Or can I just chill at home with this? That's what they do. So they don't have to, pay, exorbitant amounts through their medical aid. They don't have to pay, these are simple things, So I first calmed them down. All my interns, all my, the people even at my level and above, they all complain about this. And it's also specific to the discipline that you're in. Actually, not really. I know dermatologists that get questions about blood pressure issues and everything. And they're like, what? We've never treated that. What are we going to do? But so for me specifically, because I'm in pediatrics, I get a lot of pediatric questions. So everyone that's a new parent, they are contacting me all the time. And I don't mind it at all. Please contact me. It's fine. It's not a problem. I can't always reply immediately. That's the situation. I don't always check on WhatsApp, and I'm not a good person on WhatsApp for most people. And then I'm usually quite busy or I'm sleeping. Either I'm busy working or I'm napping. You have to just be patient, but you will get a response, and I like it. So please keep them coming, and if I can help, I will. We all have to realize and understand our limits. So, I always tell them, don't just faff and don't make up things and don't, just try to get them off your back. If you can help. But if you can't, tell them where they should go to. Say, oh no, you should go into hospital. I can't help you with this. And be honest about it. You don't have to be scared or worried, because some people are just like, oh, they have this ego that they are the doctor. They should know everything. That's complete rubbish. Why are there specialists? Why are there multiple? Why is there the second opinion? You need this. And, many people don't realize that this ego thing they have to overcome. So I always say, I love it. And I help within reason. So I get a lot of people asking me about rashes. So I get pictures of all my little not niece, it's like my cousin's children or the cousin's family or friends, whatever. And they send me pictures of, I'll just get a picture of a foot, or get a picture of the back of the head or something, or elbow crease or something. I'm just getting pictures of with rashes on it and stuff, or snotty noses. I get pictures of videos of I just get those types of videos all the time. And that's quite funny, but I mean, if I can help, I'm going to. Obviously there's no special treatment or anything like that. If you need to get into a clinic, you need to go, unfortunately. But that's the reality. One interesting situation I'm always faced with is, currently I'm working in pediatrics, right? That's my area. That's what I want to do. But not all family are children. So I get a lot of family that are a little bit older, like on the other spectrum of a kid, like 40 plus, 50 plus, 60 plus, and they're coming to me with all these things. It's funny. But it's just a situation where you know your limits and you tell. And most of the time, they just need a supportive ear. They just want to complain or vent or, vent, because most of adult complaints and illnesses are because of behavioral problems, chronic diseases, this, smoking related or lifestyle related in some way. So there's nothing I'm going to be able to do. That's a personal journey, that's a behavioral change is a personal journey, and that's something that you need to see to yourself. So that's where I just calm down and I just say, oh yeah, shame. Oh, what are you gonna do? You're on your medication. Are you taking a medication? Oh, you're not taking a medication. Are you doing what the doctor told you? Are you cutting down on smoking? Are you eating healthier? Oh no. Are you going for a walk? Oh no, you're not. Oh, maybe you should try that. So it's literally just supportive here most of the time with my family. Or they'll say, oh, what does this medication say? How often should I take it? Should I be doing it in the morning? Should I wait with food? So that's easy stuff. I can help with that any day. When you call me for an emergency, like, oh, I'm having a heart attack, get to the hospital. What are you going to do? I can't do anything about that right now. Or even if I had to come over to you, we'll be going to the hospital anyway. So it's just a situation. So that happens quite frequently. So I always say, you're a little bit old for me at the moment. Just a little bit. My cutoff is 13. Because of pediatrics, we cut off at 13. But yeah, that's just a joke I make with them. I always try and lend a supportive ear. And if I can help, I help. And I also refer them in the path that they need to go to. I'll say, oh no, you don't need a surgeon. You need an orthopod, type of stuff like that. Situation with my interns, so they come to me, especially with the pediatric cases and stuff, and they'll be like, Adli, look at this rash, or what should they do with this kitty? They run out of medication. Should they go and fill it up? And they didn't complete the antibiotics. Now what do they do? And I'm always like, that's fine. I'll help within reason, and they should too, and you should too. If you're a doctor in that situation, please take it. This is literally what you've done for. I mean, what's the point of going into medicine if not to help others? And I don't know about you guys, but I love to help my family if I can. So if I can be of service to my family, sign me up. And keep them coming. Just don't expect an immediate response. Of course, I get I got an interesting question about this one newborn that was my friend's child. She was actually I just think jogging my mind right now. He was a new father, and they weren't in the country, and then the mother gave birth. It was a normal delivery, and then the next morning, the child was coughing up blood. Not coughing, but vomiting. It was in the vomit. There was a little bit of blood. So obviously I got to, I was like, oh flip, that's quite hectic. Or it could just be the products of the conception of the birth. And so they still had to go check it out. I said, no way, I'm going to just say this, it's over the phone, yeah. So they went to go check it out, but at least I said, look, yeah, it could be something bad. It's most likely something not too serious. And it wasn't, luckily in her case. So the child was quite fine. But they went into hospital and all that. So yeah, I just want to give a message to all those people in the medical field. Relax, guys. Your family love you. Your family know that you're a professional, and it's a good sign that they think that they can trust you like this. And if you don't know, you don't know. You saw my last video. I'm sorry, I don't know. I need help. Implement it, especially within your family, and know your limits. But yeah, please don't shun them. Family is important. Sharp.